everyone, I am Keishan Mebo from BSN 11G and today I will going to perform administering oral medication. But first, what is administering oral medication? It is the most common and least expensive of the most convenient route of administration for the patients. In doing so, it is important to remember and adhere to the 10 rights of medication administration to avoid making errors and ensure the client's safety and well-being. The 10 rights of medication administration includes right medication, right dose, right time, right route, right client education, right documentation, right reviews, right assessment, and right evaluation. First, check the physician's order to know what medication should be given to the assigned patient. So next, check the MAR or the medication administration record with the physician's order for drug name, dosage, frequency, and route. Always receive the required training on use of the medication system for each agency to avoid preventable errors. Verify client's ability to take medication orally. So sir, can you take medication through your oral?
Yes.
Okay. Organize the supplies so that all the supplies kept clean and complete. So as you can see here, the supplies are already organized. Brings the requisites to preparation area to conserve time and energy. The requisites includes medicine cup, medicine tray, stethoscope, and sphygmomanometer if needed. Washes hands to protect myself and my patient from infection and cross-contamination. So next, read the MAR. Take appropriate medicine in the box. Read label and removes medicine from the box so that the drug name, frequency, dosage, and route will be inclined from the physician's order. So as you can see, the drugs are already set. And next, compare the label of the medication against order of the MAR or computer printout so that we will be able to know if the medicine that we get is inclined to the order on the MAR. Rechecks the label of the medicine with the MAR. Notes also the expiration date so that to double check if the order and the medicine that you get is inclined and if the medicine is still good to be used. Prepare the prescribed medications, tablets or capsule. If in a bottle, gently shake the prescribed number into a bottle cup. If in a box, shakes prescribed number into the medicine cup to distribute active ingredients in the medicine. Liquids and suspensions. Thoroughly mix the medication so that the active ingredients are eventually distributed throughout it. So first, mix the medication. So next, remove the cup and place it upside down on the countertop so that it is ready to be poured and keep the cup clean. And then, remove the cap and place it in the countertop upside down. Hold the bottle so the label is next to your palm and pour the medication away from the label to be able to read if the medicine you've got is right. Place medicine cup on a flat surface at the eye level so that when you pour a liquid then it will be equal and you will be able to see it. Place a thumb on a prescribed level and read it at the lower meniscus to have a sign where that's all needed. The meniscus is the curve in the surface of the molecular substance when it touches another material. This is done to have an accurate reading of the measurement of the liquid medicine, which is like this. So next, pour the exact amount of the medicine prescribed into a medicine cup to follow the prescribed amount of the medicine. Wipes rim of bottle with a paper towel or tissue before cupping the bottle so that medicine bottle will remain clean. Drops. Using a medicine dropper and draws up the amount needed for us to get some liquid medicine in the amount needed. Place filled medicine dropper inside the medicine cup to ready it for administering the medication for the patient. Place the prepared medication and the MAR together in the medication cart to be able to ready it for checking the amount needed and administering it. So as you can see, all the medicines are already in the medicine tray. Check the room number against the MAR before entering the client's room. To be able to know if the assigned room to you is inclined, provides privacy to be able to keep all the happenings confidential. So as you can see, I already closed the door and the curtains to provide privacy to the patient. Introduce self to the client so that the client will know who's the nurse administering some medication to him or her. So, good morning, sir. I am Keisha Nuevo, your student nurse for today. At each client bedside, identifies client by asking client to state his or her full name or checking the wristband to be able to know if the patient that is being assigned to you is inclined. So, okay, sir, may I see your wristband? Please state your complete name and birthday, please.
Olan Carcalope, December 11, 2002.
Okay, thank you. And how would you like me to call you?
Olan.
Okay, Holland. So at this time, I'll be giving medications ordered by physician to you, which is Dr. Magallanes, okay?
Yes, ma'am.
Okay. Ask the client for any allergy so that we will be able to know if the client has some allergy and assesses it if he or she is allowed to take those medication. Holland, are you aware of any allergy that might have certain to you in any medication?
No, ma'am.
Okay, that's good to hear. If medication is highly acidic, example aspirin, can be given with a snack such as crackers if food is not contracted to reduce side effects of the stomach irritation including indigestion, stomach inflammation, or ulcers. At the client bedside, match up the MAR or medication administration record with the names of the medication as shown on their labels and with the client's name to be able to check if the medication that you take is right as what in the MAR indicated. If needed, perform pre-administration assessments such as taking blood pressure, pulse, and respiratory rate to be able to know if his or her blood pressure, pulse rate, and respiratory rate is at normal. Okay, Holland, before I gave you your medication, I need you to check first your blood pressure, pulse rate, and respiration rate, okay?
Okay.
Okay. discuss the purpose of each medication, including relevant information such as its action and its possible effects, so that the patient will be able to know what are the medicines he or she would be taking and what are some happenings after he or she take it. Okay, Holland. Dr. Magallanes has prescribed you with Novelexin. Generic name is cephalic, which dosage is 500 milligram to be taken every 8 hours. And it is tablet, which means you'll be taking it orally, okay?
Yeah.
Okay. So cefalexin is an antibiotic bacterial, which means it kills bacteria that causes your infections and get you sick, okay? Okay. Dr. Magallanes also prescribed you with Robofin. In its generic name is guaifenesin, which dosage is 500 ml to be taken every 4 hours, and it is syrup form, and it's still you have to take it orally.
Yes,
Okay? Okay. So guaifenesin increases the production of your respiratory tract fluid and liquefy or reduce viscosity of your tenacious suppressions, okay?
Yeah.
Okay. Assist the client to sit or to side lying position, to the position of the client in a comfortable one while taking his or her prescribed medicines. Okay, Holland, can you sit? What do you want to do? Sit or side lie?
Sit.
Okay. And are you comfortable with that position?
Yes,
Okay. Administer the medicine to the client so that the client be able to take it is what the physicians prescribe. Give the client sufficient water or preferred juice to swallow the medication so that the patient will be swallow the medicine, especially the capsules. Okay. Hold on. Water. And here. Okay. Stay with the client until all the medications have been swallowed to assure that all the medicine that you administer to him or her is swallowed. Because there are some tendencies that when the nurse is already leaving the room, the administered medicines will be put in the trash by the patient. Okay, Holland, are you already swallow all the medications that I administered to you?
Yes,
Okay, good. And now that you're done taking your medications, I'm gonna leave you here so that you can have some rest. Okay.
Okay.
Okay. By the way, do you want anything or anything else?
No.
Okay, I'll come back after a few minutes to check up on you, and thank you for your cooperation, Holland.
Yes, ma'am.
So next, documenting the following. Now that I am done with the administration of the medication to my patient, I'm going now to proceed the documentation process of the procedure which I have just done. Medication given, time, route given to have some records about what medications you gave to your patient, what time you have it to him or her, and the route. So I given my patient two types of drug as per doctor or physician order. The first is an antimicrobial drug with brand name of Novelexin, generic of cephalaxin, dosage of 500 mg. Frequency, it will be taken every 8 hours per oral. The second type of drug that I given my patient is the anti-intrusive drug, which brand name of Bropofen, a generic name of guaifenesin, with a dosage of 5 ml in the frequency. It is to be taken every 4 hours per oral. Any complaints or assessment of the client to have a record if the patient has some complaints while administering the medicine, if medication was refused or omitted, and reason for omission, to have documentation why the patient refused taking the medication and what is the reason in it. Signature, to be able to signify that you carried out the doctor or physician's order. Replenish stock, especially medication stock, and return the cart to the appropriate place to keep the stocks organized to its assigned places. After care the equipments, soak it, Rinse and dries equipment, use and return to its proper places. To keep the equipment clean and to be able to reuse it for any administering of the medications.